This is one of those stories that comes up in the news every once in a while that you
I,
know, it's hard to report the story because you want to pour your heart and soul into it because your heart and soul are bleeding.
and then it was even worse when I found out and had to report this news.
Yeah. So anyway, the story began with a fellow who was jogging. His name was Dave Stevens.
He was jogging on White Rock Creek Trail earlier
Right.
this month.
And
He was hacked to death with a machete.
He was attacked and murdered, and apparently it was just, somebody just
It was
picked him at
random.
random.
Yeah.
Right? Now his widow, Patty Stevens, has apparently killed herself.
Committed suicide in the couple's Sunnyvale home.
She had told the Dallas Morning News she was struggling to eat, to sleep, to think clearly. This was a week after his death. She said, quote, "Dave was the love of my life, and I'm lost without him. People need to know that this was a wonderful person going out and doing what he loved to do," meaning the jogging. And apparently she just got to the point where the pain
Was too much.
was not worth the effort to overcome it.
Yeah, Rusty Lozano is a behavioral therapist with the Center for Biofeedback and Behavior Therapy in Addison, and he joins us now to sort of help us process this. Good morning, Rusty.
Hi, good morning, Dave. Good morning, Amy.
Morning, Rusty.
So,
Yeah, I wish
gosh,
it was under better
you must have felt
circumstances.
like everyone felt when you heard the news that Patty Stevens took her own life.
Yeah, it's actually very tragic. Very disheartening, the whole story. And it's something that I think is going to create a rift for a good time to come, especially with the holidays coming, and being close to your family and how we share traditions. But yeah, it's very, very, very sad story.
A couple of things come to mind for me, and I think Amy and I are on the same page on the first one, and that is just a couple of days ago I was looking at my it's that time of year where we elect our benefits and so forth, and I was looking into increasing my life insurance and thinking to myself, well, wait a second now, you're getting on in age and you better buy your wife some life insurance, because if she goes, half of your income is gone, and how are you going to live, and that kind of thing. And I started thinking for the first time about the actual possibility of my wife meeting some horrible fate, and how would I carry on? And I don't know, because I've never been in that situation.
We never really think about things like that and how quickly something can happen. And, you live your whole life married, and you start to identify yourself with this couple, and you essentially you mesh each other with the characteristics and behaviors and traditions. And when that's torn apart from you, I think it's really difficult to try to find some kind of clarity. And, it brings into question mortality, like exactly as you're mentioning.
Yeah.
In this particular situation, Mrs. Stevens, and they didn't have any children, so there were no children there to sort of live for, I guess. So you think she just gave up and just that was it?
I think that, in desperation, there's a lot of things that probably hit at once. And one is the shock and trying to overcome the whole reality that, my life is different from this moment on. And grief can strike us in all kinds of ways. Some people become very internalized, and, they need to seek help. And other people, out of desperation, things come down on them like a pile of bricks. And this is the type of thing that can happen, acts of desperation.
Yeah. I had a friend who killed himself a few weeks ago, and nobody saw that coming. Nobody, we still can't comprehend the depth of his despair. We didn't even know he was sad. He was a happy guy. He was always cracking people up and stuff. What is it about suicidal thoughts, the people who act upon it and those who don't? What's the difference there?
The people that act upon it and people that don't, I think that you look at the mindset of the desperation, and in the moment. I know myself, I've worked with patients, and one, it's approaching a year in November that he had committed suicide. And in that situation, it was just a very quick, very uncalculated action. And then but going back and looking at it and looking at his characteristics of who he was, I think to myself, did he really mean to do it? And in that case, I think it was probably a mistake, and it was just something that just got too heated and it went too fast. And these things happen so sudden. And then as we try to pick up the pieces of somebody who's departed us, it can be, there's all kinds of speculations, and we try to find out, try to get answers and closure to try to really understand what happened.
Yeah, you said something that really caught my attention. You said that in this case, his suicide was probably an accident. He meant it, but he might have changed his mind. And we read that people who survived suicide attempts are glad that they did.
Yeah, you hear that about that all too often. It's just a quick, and sometimes, and I can't generalize that, but oftentimes you see it's just an act of desperation, and it just seems like it's the best plan at that particular point.
If someone, excuse me for interrupting, but we are out of time. If someone feels desperate right now and they feel a situation similar to Patty Stevens, where can they turn for help this morning?
Well, I think that, one would be a more immediacy would be 911, but if not, there's the crisis line. It's an 800 number, and it's 1-800-CRISIS, and I think that that's something that you can actually, reach out and try to get some help for yourself. And if not, you can confide in a family member to find a mental health professional to see if they can guide you into some sort of treatment.
Mm-hmm. Rusty, thank you very much for your time this morning. We appreciate it a lot.
Absolutely.
We'll try to talk to you again when we have a happy conversation to have with you.